For evidence-based practice, it's important to learn new skills for searching article databases to find answers to clinical questions. In this video, I'll talk about the techniques that will make your searching more efficient. While you're used to using search engines, such as Bing, Yahoo, or Google, for finding many things, they're not a good way to find evidence-based answers to clinical questions. Article databases, such as PubMed, Embase, Synonyms, and others, provide a more structured environment for searching. They contain both the primary literature, such as reports of clinical trials, and the secondary literature, such as systematic reviews. Databases are also often indexed, using terms with specific definitions. Knowing how to work with these index terms will help you to create more precise and efficient queries. Let's begin with a clinical scenario. A 60-year-old patient has been taking oral bisphosphonates for osteoporosis for several years. She now needs to have a dental implant. You know that there can be serious problems for patients who take bisphosphonates and have dental procedures. What advice should you give the patient to decrease her risk of osteonecrosis? Because this is a clinical question, I'll use the Pico Framework. It helps you to distill the main issues in complex patient presentations into a question or series of questions that can be answered in the journal literature. P is for patient, population, problem. I is for intervention. C is for comparison, if any. O is for outcome. Here are the major concepts in this clinical scenario. P, 60-year-old female patient, osteoporosis, bisphosphonates. I, dental procedure. C, current care. O, decreased risk of osteonecrosis. Not every fact may be included in the research question or used as a search term. For example, age or sex may not be needed in the search. Sometimes you'll need to use a broader term in the search, for example, dental procedures instead of dental implants. The concepts from this scenario can be phrased as a question. How can the risk of osteonecrosis be managed in a 60-year-old female patient taking bisphosphonates who needs to have a dental procedure? Next, I'll think of synonyms for the major concepts. Synonyms are an important part of a well-constructed search because they can help appropriately broaden a search concept. Here I've listed synonyms or related terms for the concepts that I'm using in my search. Bone density for osteoporosis, bone cancer and jaw diseases for osteonecrosis, dentistry for dental procedure. If you can't think of a synonym for each concept, that's okay, but you should use synonyms for most of your search concepts. Next, I'll build the search logically. Boolean operators, such as and or, are used to define the relationship between search terms. Or is used to connect synonyms or related terms. It helps to appropriately broaden a search. For example, if I search for osteonecrosis or bone cancer, I'll find citations for all terms together and each term individually. And is used to connect concepts and gives you a smaller set of results. For example, if I search for osteoporosis and osteonecrosis, I'll retrieve only those articles that contain both terms. Here's the search that I've created, connecting the synonyms using or and the concepts using and. This search will work in any database or even Google Scholar. I've placed the synonyms within parentheses, which tells the database that certain terms should be searched in a certain way. If you forget to use parentheses, your results won't be as useful. Note that I've decided to try my search first with 3 concepts. If my search results are too large, I'll add the 4th concept, dental procedure. To find PubMed and other resources, use the links on the left side of the Taubman Health Sciences Library website or use a departmental or course research guide. Accessing databases from a library website, at home or on campus, will connect you to all of the journal subscriptions paid for by the library. If you have any questions, please contact your informationist or the Taubman Health Sciences Library.